I hope you can hear me. Alright, so I'll get straight to the point here. I'm going to do the introduction right at the end because when I read the papers, I have to read the conclusion first and then I go to the body of the paper. So I'm going to talk to you about metabolic syndrome. How many of you would like a slimmer waist? Could you raise your hands if you can? Right? Most of us would like to have a slimmer waist, right? And what I'm going to talk to you about is basically metabolic syndrome. I'm sure a few of you have heard about this. So what is metabolic syndrome? Basically, it's the gaining of visceral fat, which is the fat around your organs, slowly squeezing your organs, draining of your blood supply. And it manifests in the form of gaining a little bit of fat on the belly. Why is this bad for you and how do you correct it? What are the symptoms of it? What are the markers of it in your blood test? That's what I'm going to talk about. So I'm just going to change the slide, please. Can you change the slide? Okay. Change it again. Alright, so this is a case example. This is a patient who was 51 years old. He was 99 kgs with a history of diabetes. And he was having difficulty losing weight. He didn't have any heart problems. He started trying to exercise a lot, but he didn't lose any weight with it. Can you change the slide? So he was on an anti-diabetic drug, and this is the treatment which was done. This is actually not my case, but this is a doctor's case who we trained. Now, what exactly did we do and what are all these things just? So let's go to the first one called as Immucin. This is a medication which I have an international patent on, and we have a published paper with a human trial as well. This was a thing that we developed actually for COVID, and in our human trial it showed 100% efficacy. This was done by the government of India, and it was a government of India approved human trial. Why am I using it on diabetes? Because what we found with Immucin is that it reduced your oxidative stress. And it reduced it to such an extent that it brought it down to almost zero. Oxidative stress is when you have some sort of infection or inflammation. The body starts to burn a lot of fuel. It's burning not fuel, but it's basically getting burned from inside out, and then it's producing these free radicals. So Immucin worked in a way by decreasing the free radical stress inside your body. And by giving it to this patient, since his oxidative stress got reduced, he was actually able to burn more fat. And this is one of the first things that we do for abdominal fat, that we give Immucin. So patients who are insulin resistant, you may be having insulin resistance without even knowing about it. What is this thing? You start seeing that behind your neck, you start getting black pigmentation. You start seeing you get skin tags. You start finding yourself having low blood sugar at times where you suddenly feel hungry and you crave for sugar. These are all signs of insulin resistance. So the first thing that the doctor gave him was Immucin. Second thing he gave him is a thing called Akkermansia, which is again our invention. Akkermansia is basically a bacteria in your gut, and in diabetic patients or pre-diabetic patients, it's usually absent. Its value goes to zero. It's a very difficult bacteria to grow, which is why you don't get like a probiotic pill made of it easily. So what we've done is we've taken out the secretion that Akkermansia secretes, which does all its wonderful things, and we've put that in our medication. So by giving him Akkermansia, this bacteria actually stops your blood sugar from fluctuating. So it makes sure your blood sugar doesn't go up and down too much. By allowing this to happen, your livers are actually able to burn fat now. So this was the second thing that we did. What is the third thing that for? That's basically like a homeopathic, It helps to regulate your cortisol levels. Cortisol, which is your stress hormone, helps you to, have salt cravings. You crave for sugar because of it. So by giving him that NAD1, we regulated his blood sugar by controlling his cortisol and his stress hormone. How do we know that he had high cortisol? Do any one of you know if you have high cortisol what the symptoms are? Actually, the symptoms are pretty simple. If your cortisol level was high, you get constipated. Because cortisol dries your colon out. And the constipation is very peculiar. Only when you start drinking a lot of water does your stool pass. So the patient will tell you, or if you are the patient, you wake up in the morning, you have to drink water, only then you can run to the loo. That's one of the symptoms of high cortisol. Your skin becomes very, very oily. You develop acne on your skin at times. So this patient had those symptoms for which Macmor was given. Naxomica, another homeopathic, it stops the blood sugar from spiking after you eat. So after you eat, within 2-3 hours, if your blood sugar spikes too much, Naxomica is the one that brings that down. Curzing is one other medication that is ours. We basically made it. It's a combination of curcumin and zinc. It's a complex of it, and what it does is it decreases the leakiness of your blood. So how do we measure it? We take a blood sample of the patient and we look for something known as LPS in it, which is basically the secretion of toxic bacteria in our gut. And when your gut becomes leaky, they start secreting it into your bloodstream. So if that happens, your body gets really inflamed and you start developing diabetes because of it. So curzing was given, leptin resistance was given. This is a drug which decreases the amount of leptin in your body, which makes you basically obese. Diabetes combo is one other med of ours, and the weight loss combo is one other med that we've invented. Basically, this patient lost 4 kgs within 11 days and his FBS became normal. If you can see, it was 10.2 and on the 12th it became 5.3. So it went down that fast. What we are really experts at doing is we are good at treating metabolic disease. So this is one case. I'm going to go to the next case now. Please change the slide. So this is Dr. B, who's in the audience. If you see a person with a big belly, that's not him because he's lost the big belly now. So this is his before break. Again, we put him on leptin resistance, initial acromegalia. There are 2 other new ones. There's one thing called LSD here. It kind of looks like the drug LSD, but it's not. So how did LSD help him? He used to like drinking alcohol a lot. After taking LSD, he lost the urge to drink alcohol. So the drug that we give him works just like the allopathic LSD. It makes you feel so content that you don't feel like drinking alcohol. Alcohol causes you a lot of abdominal fat. Then we gave him something called a saccharin, which is basically a homeopathic made from sugar. He had a very, very strong sugar craving. He would need to eat sugar all the time. So after saccharin was given to him, he lost the need to have sugar. And of course, that weight loss combo. Can you change the slide? So this is him after 2 months. You can see there is no belly. So now if you see a person without a belly, that's probably Dr. B. So the change is really dramatic and very fast. Now, let's go backwards to see what is metabolic syndrome and how is it leading to diabetes. Yeah? So what happens in your body? First, most important thing that leads to metabolic syndrome is stress, which has been ubiquitously spoken about by everybody on the stage. Right? How do you know that you're stressed? Can anybody tell me if they are stressed or not stressed? How would you know if you're stressed? Anyone really? How would you know that you're stressed? You can just speak up. Well, you don't really know, right? You think maybe I'm stressed, maybe I'm not. I don't really know. If you're stressed, your sympathetic nervous system, the one that makes you run away from a lion or a tiger, gets hyperactivated. And when that hyperactivation happens, your palms become sweaty. Have you gone to an examination and found that your palms become sweaty? Yeah? Your heart rate tends to increase. You find it difficult to digest food. When you're stressed out and a person gives you food to eat, it just stays in your stomach. You get frequent bloating and burping. These are the first signs that you're getting stressed and you're going to land up getting metabolic syndrome. The burping and the bloating is a very classical feature. How does a raised SNS make you obese? Because as your SNS levels go higher and higher, it increases a receptor known as a beta adrenergic receptor, which makes it difficult for you to lose weight basically. So you start gaining weight. Also, as your SNS increases, you're not able to remove infections from your gut very easily. You become immunosuppressed. As the good doctor was saying, you require your immune system to be active all the time. But if you're stressed out, your immune system is not active, and those little bacteria start leaking out into your bloodstream. So how do you fix this? Okay, how many people have problems with bloating and burping here? Could you raise your hands? Constant like bloating and burping. Anyone? Nobody? I guess you may be having, but you're not putting your hand. So what we do is we use another homeopathic called as lycopodium. It's basically a medication which resolves this high insulin drive. For most of the patients who are in the initial phase after we give them lycopodium, they are completely done with their bloating and burping. They're no longer angry and they become calm individuals. We had a case a few days ago where Dr. who we found these concepts to had told us of a case of a lady who basically roamed around quite a few places trying to treat her chronic bloating and burping issues. She was highly stressed out, couldn't sleep in the night. And when the moment the doctor saw her and she said, "Well, what's your problem?" The patient said, "Well, I burp a lot constantly." Gave a couple of doses of lycopodium, 3 days, she was done. All the symptoms vanished. So that's your first stress hormone, which is going to make you get metabolic syndrome, which is basically the abdominal. The next hormone is cortisol, which I said where you will start having constipation, you have to drink a lot of water to pass through, your face will become very oily. If these two hormones keep going up, your insulin levels are going to keep rising. As your insulin rises, it's basically trying to suck your glucose that's floating around in your blood and put it into your liver and store it in your liver. It does the same thing to your brain. So you basically start having bouts of low glucose going to your brain. That makes you very hyperactive. You won't be able to calm down and just sit. You won't be able to meditate. You won't be able to relax. Because there's no glucose to your brain. You've had this experience, I'm sure, of being hangry, which is hunger with anger. As basically your body's becoming insulin resistant. That same insulin resistance is going to cause fatty liver disease. All that cholesterol is being built up in your liver, you end up getting fatty liver disease. Then your blood pressure starts going up, your blood sugar starts going up, and that abdominal fat starts building up. As the fat starts building up, you may notice that when you're driving a car, you start having back pain. You're not really comfortable while driving because you're sitting like this. You find it difficult to tie your shoelaces at times. It's all that visceral fat. You may appear thin and yet have all that fat. How do we as doctors check this out? Now, when a patient comes to us and we see many young children who come with this, they come with things like acanthosis on the neck, where behind the neck they have black pigmentation. They have a lot of skin tags on the neck, little black tags of skin which are sticking out on the neck. The patient's mother will tell us that this kid is never going to sit in one place and study, he's constantly running from one place to the other. He starts gaining weight a lot and they start eating like crazy. They need to eat a lot of food because even though they have almost like a pre-diabetic state, that insulin which is so high is sucking all the glucose out and storing it in the liver. So they need to eat a lot of sugar and a lot of glucose and to keep the blood sugar up. So this is going to be your first symptom, the hangriness, the acanthosis, the skin tags. Then we start doing blood tests. We look for markers like your fasting insulin. If you want, you can have your fasting insulin levels checked. If they are high, it means you are getting insulin resistant. You can check a marker known as HSCRP. If you guys haven't heard of it, it's called as high sensitivity CRP. If it is elevated, that means your body's basal inflammation is high, and it's one of the most important markers that you're going to get heart disease and diabetes. These are your two most important markers to do. You can check your iron levels because one of the symptoms in metabolic syndrome is your iron levels will start to go down. Your vitamin D levels will start to go down. Okay? These are all markers that you can check. Now, we as doctors will check all these and we have devised strategies how to handle each one of these things specifically. So we train doctors, we've been training doctors now since the last 3.5 years in how to understand disease from an immunological perspective and an inflammatory perspective. So once we understand what this is, then we start treating the patient. We use some of my patented stuff, which is what you've heard of, that means like acromegalia, imucin, and also we use simple homeopathics in order to treat the patient. We don't even require complex testing. The reason why we don't require complex testing because, as I said, each one of these factors has a symptom. And what we teach doctors to do is how to understand those symptoms. So usually when a doctor looks at the patient and the patient says, "I have bloating and gas," the doctor says, "Well, you can take an antacid." He doesn't actually understand what that symptom means. Now we are teaching him what that symptom means and how to go about solving it. So as you can see, the fix for diabetes and blood pressure is not that difficult to do. It's actually quite rapid. All the treatments that have been given for diabetes, my uncle was world head of diabetes into the green diet. All the treatments that he was doing for diabetes, which is basically giving insulin, it's actually making the problem worse. Because you're just putting insulin in a patient who's already resistant to insulin. But unfortunately, that was the only treatment done. The problem that I see with alternative medicine, now, this could be called as alternative, but it's not really, because this is sometimes it's not really alternative medicine, it's the only alternative a patient has besides allopathy. So when you're doing things like this, you need to have the highest level of scientific evidence when you're doing it. So we have published papers, we have our own rat lab, where we actually run our experiments on rat cell lines, on rats. Then we take it to human trials, and only after that we take it out in the public domain. This is a very complex field to understand, so it takes doctors around 3 years of training to actually be able to understand inflammation and disease. But if you see the results, they are super fast. If you'd like, we are planning on holding a larger conference which is free for the public. I think you can contact Amanda, there's a booth outside, which is to your right, in the last booth over there. If you'd like, you can sign up for this. What we are hoping is to teach the common public how to understand metabolic disease, how to understand inflammation. You may think that you're not qualified because you're not a doctor, but we can really make this simplistic for you so you can at least solve these problems for yourself really easily. Okay? Now, my introduction comes last. So my name is Dr. Tariq. I'm from India. I'm the scientific advisor of a pharmaceutical company, and I have several patents on my name. One of which is for Immusil, which is a COVID drug. It not just treats COVID, but actually fixes long COVID as well. There are many people here who have actually been cured with it. Human trials showed a 100% efficacy with not a single failure. So yeah, that's what I've been doing. I have several certifications from Harvard in immunology, genetics, physiology, pharmacology, and quite a lot. So that's what it is, and that was my topic. So if any one of you have symptoms of insulin resistance, when you have this angry feeling, you have bloating and burping, you have constipation, you have acanthosis, which is a black pigmentation in the neck, or you have clearly high blood sugar or high blood pressure, please sign up for our free conference. It's going to be a free one. We will just come and talk to you and explain these things to you. Also in the free conference, we will have lots of the doctors in each day who can actually come and personally help you and help you with your particular problems. Yeah? Thank you all for coming.